Hello, good morning, everyone. Thank you so much for joining our training. We're gonna give it another minute. I see people are still joining. So yeah, we'll get started shortly. Good morning, everyone. It's 11:02. We're gonna go ahead and get started. We do have quite a bit to cover. So we just, we'll go ahead and get started. I do want to let everyone know that this training is being recorded. So it will be made available and we'll make sure to send it out. But also happy National Health Center Week. Thank you so much again for joining. Welcome to our Advocacy 101 training on civic engagement. This is our third Advocacy 101 training of the year. We launched a series of quarterly workshops earlier this year. And, just like I mentioned, all of the information covered here today will be sent out and it will also be on our California Health Plus Advocates website as well. So if we can go on to the next slide, please. Hey, so my name is Eric Paredes. I am the Associate Director of Grassroots Advocacy at the California Primary Care Association. I do want to pass it over to our amazing co-presenters to allow them to introduce themselves as well.
Hi, folks. My name is Lisette Escobedo. I am Associate Vice President of Civic Engagement and Advocacy at AltaMed Health Services. It's wonderful to see very familiar faces and work with you all, and I'm happy to share a little bit of our lessons learned in terms of running our civic engagement work. I'll share that I've been doing civic engagement for about I would say 12 years, so I'm sure I'm getting to 13 at this point. And really excited to do this work now within the healthcare field, and have just been very excited to work with you all in these past year and a half or so to do this work. Thank you, Eric.
And hi, everybody. I'm Mike Locke, go by he and him. I'm planning manager at Asian Health Services. We're based out of Oakland, California. And happy National Health Center Week to everyone, all of you CHC superheroes. I see my colleague, Jason Akima, who's our facilities manager on here, and he's always down to help. But like I always say that regardless of what roles people have in our agencies, we're all advocates for our communities, regardless of whether we see patients or not, or community or not. We're all in this together. So looking forward to chatting with folks.
Great, thank you for introducing yourselves. And as previously mentioned, this is our third Advocacy 101 training. In the materials that we send out today, we will also send out the recordings and slide decks for our previous trainings. So just wanted to make note of that in case you were not able to join our last two, or you would like a refresh. So next slide. So in today's training, we will be spending some time talking about the importance of elections. We'll also talk about, a little bit about the 2022 general election and what you can expect to see on the ballot. In this training, we'll also discuss, really why it's so important for community health centers to participate in civic engagement work. We'll hear from Lisette and Mike about the amazing work that they do at their health centers to activate their patients and their communities. And they'll also share some tips and best practices on how health centers can launch their own civic engagement programming. We'll briefly cover the resources available for health centers that California Health Plus Advocates has put together. And before we move on to the next slide, I do want to make a note that there will be time for questions at the end of the training. So if you have questions, feel free to add them to the chat. But if not, there will be time at the end. And now I do want to turn it over to a video that the Secretary of State, Dr. Shirley Weber, has sent to us really to kick off this training. So Mara, I'll pass it back to you.
Good morning to all of you, to all of the health centers of California. I'm California Secretary of State, Dr. Shirley Weber, and I really welcome you to this meeting. I'm delighted to be able to speak to you, particularly those during this National Health Week, something that we should always think about. The Health Center Week is extremely important because of the work that you've done and you continue to do in our communities. You truly are the backbone of all of our health systems, and so many depend on you for the kind of care that they deserve to have, and we celebrate you for your dedication and commitment to our communities. You know, when I think of health centers, I think of the fact that I grew up as a kid without really health care, without a credit, without a health card or any identification that would get me into anything other than a clinic in a community. And they were few and far between. And my brothers and sisters, the 8 of us, often think about the fact, my God, where would we have been if it had not been for our mother who understood all the home remedies of the world and kept us healthy and safe, because we surely did not have access to health care, at least preventive health care. And I know when I became a student at UCLA, I was amazed because I got a UCLA identification card and access to UCLA Hospital and the health clinics. So community clinics are born out of the civil rights movement. We remember health centers in communities because people didn't have health centers. And so you had a number of clinics, free clinics that established so people could actually get preventive health care. And I can't emphasize to you just how important that is. We're fortunate today that we now have the legislature and others that are really focusing on health, making sure that our health centers are available and accessible in every community, and that's extremely important. But you know, as Secretary of State, I must admonish you to basically make sure that you, the providers, and all of your patients, that you're registered to vote and that you vote. Because it's through that action that we're able to continue to fund our health centers, to make sure that we have the right health centers in every community, and make sure that we are accessible to all of those who need it. As a kid who didn't have health care as a kid, I cannot say enough good things about health care. Like I said, when I got my health card, I had thought I'd died and gone to heaven, and I could go to free clinics at UCLA. And when I became an employee and had basically a Kaiser card, it opened up the world. And that should not be the activity or the reality for the current situation, but it was my current reality. And I value all of you and the hard work that you do, because with your help and your work, we can even do greater things. So once again, congratulations to all of you doing National Health Center Week. I am very proud and grateful for the work that you do. And I want to encourage every person who is in the sound of my voice, who is a citizen in this country, who can register to vote, to make sure you register and you vote your interest, because we have still much work to be done. But once again, thank you so very much. And I want to encourage all of you to basically help and support health centers around the world. Thank you so much.
Great. Really awesome video. Really glad, and thankful for the Secretary of State for providing that ahead of this training. So now we're just going to kick off talking about the upcoming general election. So the 2022 general election is taking place on Tuesday, November 8th of this year. All active registered voters will be receiving a vote by mail ballot. This election is what is known as a midterm election. And what this is it's an election that is held near the midpoint of a president's 4-year term. And, I really just want to emphasize the importance of all elections, regardless whether, it's a presidential or a midterm. Historically, during midterm elections, there is lower voter turnout compared to a presidential. And, I just want to encourage everyone who is eligible to vote to come out and vote. Talk to your family, your neighbors, your friends about the election, because there's just so much on the line. The people who are elected in positions of power, make decisions that directly impact our everyday lives. And in addition to this, there's also statewide and local ballot measures that are important and will impact our community. So what's on the ballot? So there are 7 ballot measures here in California. There are statewide candidates, inclusive of the list here below that you see on the screen. There are also federal and state representatives up for election, including the U.S. House of Representatives, the State Assembly, and some Senate members, and also other local candidates and local measures in your community. So, again, encourage everyone to vote and vote for, fill out all those positions, because all those positions are important as well. So next slide. Great. So I just briefly want to go over a couple important dates and deadlines. So the first is National Voter Registration Day. This is on September 20th. It's a good opportunity for us to really, encourage our communities to come out and register to vote if we are able to. Ballots begin to be mailed out by the county offices by October 10th. The deadline to register to vote in California is October 24th, but I do want to remind people that in California, you can register on the day of. National Vote Early Day is October 28th. Again, another great opportunity for us to encourage people to come out and vote, drop their ballots in the mail, or take them to their county offices or a secure location. And then Election Day, like I mentioned previously, it is November 8th. And just a quick reminder, vote by mail ballots will be counted if they are postmarked on or before Election Day and received by November 15th. And also in person, you can vote in person at a secure box, location, county offices. And if you are voting in person and you're in line by 8 p.m., stay in line, your vote will still be counted. Next slide. And then I just, want to quickly go over some resources for California voters. So really encourage everyone to check your voter registration status and update it if you need to. And thank you, Raquel, for adding these links here. Also, you do, I also want to encourage everyone to do some research on the link here on the slide. We have a Civic Engagement Center where you can actually see who is running in your district and in your where you live. And I know there's a lot of maybe mix up because the districts were redrawn. So check that out, and then also vote. So make sure that you make a plan to vote. There are several different ways that you can vote, including by mail, dropping off your ballot, or voting in person. And then also just want to encourage everyone to track your ballot. California has a really cool feature that you can subscribe to. You will be notified as soon as your ballot is received and if your vote is counted, as well as maybe the signature doesn't match, and you can go and correct that. So, just some resources here for voters. Next slide. Great, so CHCs and civic engagement. So if you are wondering if the health center can participate in civic engagement work, the answer is yes. Community health centers can and should engage in this work. And just like Dr. Weber mentioned in her video, community health centers were born out of the civil rights movement, and they hold the key in ensuring that our democracy remains robust and resilient. And as a lot of you know, 1 in 5 Californians are patients of community health centers. So that's a lot of potential voters that we can really provide resources to. And health centers can ensure that their patients are given the opportunity to register to vote, have access to resources about upcoming elections, or maybe candidate forums that are nonpartisan, and are also reminded about the important dates and deadlines that I just covered a minute ago. Health centers are allowed to do all nonpartisan activities. Some of these activities do include voter registration drives, registering people to vote as they're signing up, maybe for their health insurance or in the waiting room. They can also do voter education by providing materials, graphics, all that good stuff. And then GOTV, getting out the vote, reminding people, hey, turn in your ballot, go vote, all of that good stuff. So next slide, please. So do's and don'ts. I just briefly want to cover this section here. So some of the do's is, do talk about elections in a nonpartisan manner. Do direct people towards appropriate sources of information, but please don't talk about the election in a way that can be seen as partisan. And also, please don't use your organization's social media to post or share information about candidates. So if you can go to the next slide, please. Great, so now I'm gonna pass it over to my colleague, Lisette Escobedo from AltaMed, who's gonna talk about some of the awesome work that AltaMed does in civic engagement. So Lisette, I'll pass it back.
Awesome, thanks, Eric. So I'm excited to share all of the work that we've been doing at AltaMed to integrate civic engagement into our clinic work as well into our communities. The one caveat I have for my presentation is that what I will present on the work that we do is very dense. And so I do encourage folks that as you explore potential opportunities in your clinics, that you take those bits and pieces of nuggets of things that you feel are feasible, that your team has the capacity and bandwidth to do, and you don't have to do all the things, right, that we're going to talk about today, but please do use our presentation and the lessons learned that we share as resources as you consider civic engagement work within your clinics. Next slide. So just wanted to set the tone a bit briefly, because we tend to, when we say civic engagement, right, there's a couple of things that happen. Folks either say, I don't want to get involved in politics, right, or directly connect that only to elections work, right? And then we think, okay, how do we engage the rest of our community who maybe can't vote, right? A lot of the communities that we serve who may be undocumented, who may be legal permanent residents. And so let's talk about civic engagement more broadly. Civic engagement is not exclusive to voting, but it is inclusive of voting. There's plenty of other things that fall within this, and this is also how you can look at your program and figure out what are the things that we do when elections aren't happening, right? There's voter registration that can happen year-round. We just came off a redistricting effort, right? Redistricting happens every 10 years. And basically redistricting determines what the districts across both state assembly, Senate, Congress, Board of Supervisors, city level, school board level, what they're going to look like and if they represent our communities. So think about how you think about these things, right? Every 10 years. There's the Decennial Census. I'm sure a lot of us actually did work around this, which is very important because it determines resources into our communities. To participate in the redistricting public comment process and to participate in the census, you are not required to be a US citizen, right? You are simply just required to be a resident of the country and want to get involved. There's also the naturalization process. We actually do this at AltaMed. I'm not going to talk extensively about it in my presentation, but just a friendly reminder that I believe the last time I checked, there were something like 8.9 million legal permanent residents eligible for citizenship that have yet to become citizens. We had a huge peak of citizenship, and that's actually one of the campaigns that I managed before I came on board with AltaMed years back. There is a huge peak almost every election where we see legal permanent residents becoming citizens, right? And they need the proper assistance to know who is eligible, how do they apply, and what are the resources they have access to. We've partnered with ILRC in our communities to actually host naturalization clinics within our PACE centers and other clinic sites, so that legal permanent residents that are our patients actually have access to information and services to do this work. So again, civic engagement, not exclusive to voting. There's a lot of other work that folks can engage in, and I'm happy to engage in conversation with folks around that. Next slide. And you know, one of the baseline kind of conversations that you'll likely have, right, at your community health centers, if you're not already having, is why do we do this work, right? We're here to provide services to the community. We're here to provide healthcare. What does this election and what does civic engagement have to do with this work, if at all? And so it's very important to connect the fact that really the access to quality care and the access in general that we provide to the communities we serve is rooted on a sense of social justice, and really healthcare being a civil and human right that all of our communities deserve, regardless of where they come from, regardless of the language they speak, and regardless of their income. And so I know for us at AltaMed, just to give folks some background, we have clinics all throughout LA County and Orange County. We were actually founded right through the Brown Beret movement, where we had mobile clinics, and we had about one clinic site in East LA called the Barrio Free Clinic, where we would provide free healthcare services, right, to immigrant communities and Latino communities in East LA. This is a very similar model, actually, from Northern California, where the Black Panther Party did something similar to provide quality care to the communities there that didn't have access or weren't receiving it. And so when we talk about why we do this work of social justice, why we do this work about power building and access, it is part of our roots as community health centers, right? And we've actually at AltaMed has spent quite a bit of time really kind of reinforcing that and drilling that home in the work that we do with our civic engagement efforts. Next slide. And another kind of piece of this puzzle, right, is social determinants of health, right? We've probably heard this phrase many times. I know when I came on board with AltaMed, I had heard about the phrase and kind of had, you know, looked into it a little bit more, and it all kind of came together, I think, for me, who has done civic engagement work, you know, mostly. When it comes to the health of our patients, right, and folks that come and seek our services, we know that when they come into the clinics or the hospitals, that we can only determine between 10 to 20% of their health, right? We can give them the medicine they need, the treatment they need. We can have them see the doctors at that moment. But the rest of their health, 80 to 90%, are determined by environmental factors that are out of the control of our clinics. What does that mean? It's determined by the air that they breathe, the quality of water, whether they have access to healthy food, green spaces. Are they, you know, our communities tend to be located, for example, right next to freeways, which, as folks know, create things like, you know, smog, pollution. And this is why our communities tend to be more prone to things like cancer, asthma, diabetes, and other illnesses that, again, are determined by environmental factors. And so when we look at how do we change these environmental factors and how do we have a transformational change in the health of our patients, it's really looking at that infrastructure and the institutional power within our communities. Policymakers and policies are the best ways to achieve these changes. And we can only build that if we get folks voting, participating in the census, and if we're holding our elected officials accountable. And so when we look at the potential impact that we can have as community health centers, we're also serving about one of every five, at least in California, one of every 5 Californians are served by a community health center, which is a total of about 7.4 million patients. Imagine if we had 7.4 million people registered to vote in the state of California or participating in some form of civic engagement. This would help us build the conditions in our community that would allow us to really address those environmental factors, also known as social determinants of health. Next slide. And so one of the really neat things we did, and I do encourage folks to do this if you have some time and you can work with your data folks, is we mapped out where our clinics are located. And then we did an overlay of where the highest density of low propensity voters are located. And then we did an overlay of the hardest to count census tracts. And, to no surprise of ours, that is where we're actually located. When you look at the communities that we serve, especially for federally qualified community health centers, it's the most underserved communities that lack access to healthcare, that qualify for Medi-Cal, right? These are the communities that tend to participate the least in elections and census and everything that has to do with building with the democratic process in essence. So when you look at those factors and you look at the fact that historically these communities, have lacked investment in power building and in really creating the institutions that will better serve them and their health, we're doing the work in the communities that need the work, right? And so again, encourage folks to do this with your clinics. Next slide. So how do we do this? And again, this is going to be overwhelming, but take the nuggets, think of the one or two things that you can do now. And we're happy to work with you all to figure out how you kind of get buy-in, right, for the rest of the work. One of the components of our efforts is our in-clinic patient engagement. We do this in kind of these informal 3 pillars. One, we look at voter registration, which in California, we are blessed to have online voter registration and pre-registration for 16-year-olds and 16 and 17-year-olds, right? And so at our clinics, we actually have voter registration forms available at all AltaMed clinics. And then we've forged a partnership with Vote ER so that at least, so at 100 of our physicians, nurses, and other providers have these badges that have a QR code so that folks can register to vote while they're having the conversation, or so that the physician can remind the patient to register to vote as they're having their conversation or to check their status. We also have information, education, and engagement. What we look at for that is really we look at the process by which the patient comes in to our offices and by where they leave and what are the interactions they have. While at the same time looking at the process, looking to not disrupt the process for them, right? Because that's key. So what we've done is we've designed tabletops, handouts, postcards, videos that play in the lobby area for those of you who have TVs and have educational information constantly playing. Can insert civic engagement information. We do screensavers. We have all of our screensavers for our staff are actually through a network. And so we work with our comms team to design those, and those go on rotation every election. Posters, rally signs, and then again, identifying and really training some champions within your clinics that are all about this work, and they will onboard other clinic members to do the same. It's really important to also engage your staff in the process. You have a couple folks buying in, other folks will get excited and want to do the same. I included there just some food for thought, right, of how do you map out the patient experience and how do you incorporate civic engagement within that experience. You can start small, then build from there. And then the last piece of the work that we've done is ease voting access. So we actually have hosted vote centers by working with LA County, the LA County's registrar office, as well as Orange County registrar office, to actually host vote centers, mobile pop-up sites, and drop-box sites. In the state of California, we have something called the Voter Choice Act, which allows every county to work with CBOs and other organizations to set up vote centers as opposed to polling locations, which means that you can vote anywhere within the county that's considered a vote center. And every county has kind of their different criteria and application process for you to host a vote center. But what this does is give folks the sense that if I go to AltaMed, I can register to vote. I can get information on voting or the census, right, or other civic engagement effort. And I can actually vote right after I'm done with my consult or with my appointment, which makes it very accessible and very easy to participate in the process. Next slide. A big one is staff engagement. We often don't think about this, right? We think about the patients and engaging. We have about 400,000 patients, but at AltaMed, we also have 3,500 staff, and about close to 90% of our staff actually come from the communities we serve. So if we engage our staff, we engage community, and likely we engage the leaders in our community. So we look at that structure as well, right? What are the opportunities to engage staff in that way? We've developed swag for them. We have buttons, we have t-shirts, we have kind of these competitions. Every Friday, we ask them to wear their My Vote, My Health shirt. We've done this with other campaigns, and they get excited and kind of do activities around it. We have internal trainings that we post on our internal staff system where folks can actually view the trainings at their leisure. We work then with our new hire orientation. We've actually, for the first time, instituted civic engagement education within our family resident program. And so it's really looking at, let's meet with the departments and figure out how do we slowly establish these systems by which we can access staff, right? Or it might just be you send an email to all staff, right before election day, reminding them all of all the resources that CPCA has or that we have, or just information on elections. It's really important to look at how you start small and kind of build up from there. Next slide. The last piece, this one is a little harder, is community engagement. The way we see community engagement is that we can engage our patients, we can engage our staff, but the only way that we can make transformational long-term change is that we must also engage the communities that they go back to live and work in, right? And so we've established a couple of different programs for that. One, we do a direct voter engagement strategy. This is like, you know, every other GOTV campaign that folks run, where we actually identify a low propensity Latino voter universe within a 5-mile radius of all of our clinics, because it's likely that we'll interact with a patient at some point. Since we can't access direct patient data because of PHI, we do density mapping for our patients. And so we purchase that data, and we're happy to help folks after this, this presentation if folks are interested in doing something similar. And then we recruit canvassers, we recruit staff who want to volunteer, we recruit community organizations that do this work, and we do phone canvassing, peer-to-peer texting, and door-to-door canvassing. Door-to-door canvassing by far has been our most successful because we found that people actually do identify with AltaMed when we visit their doors. One of the things that we did with the primary election, which I'll share in just a bit, is that we mapped out all of the precincts where we had at least a 20% patient density, and that's where we did doors. Everywhere else, we did peer-to-peer texting and phone canvassing. We also do other direct community engagement through our existing programs. We have e-blast, we have mass texting. These are a little bit easier. We have our social media, right? And we're happy to share tools that we develop. And then we have a paid and earned media component where we actually do a very strategic and targeted Facebook and Instagram lead generation ads. And some of our partners who help us with that are actually on the call today. So we're very thankful for their partnership. We do ad buys, and really it's this tie-in to vote for your health, which is a very different message than a lot of the GOTV messages and campaigns that are probably running parallel to our work and to the work that you might be doing. Next slide. The one other thing that I'll mention, and my apologies because I should have mentioned it earlier, is that when we do community engagement, something that's very important to think about is that, you know, again, in my previous work, mostly worked on civic engagement for Latino communities. Every poll and every focus group and all of the research that we've done continuously supports the fact that while Latinos have a huge distrust for government, right, they have a trust for their healthcare providers. What does that mean? That amongst the most trusted messengers identified in that research were doctors, nurses, and teachers. And so when you look at what is the impact that we can make versus what other organizations are doing, we have access to the doctors and to the nurses, right? And we all know this because in our communities, you know, I remember growing up, and if my teacher said it or my doctor said it, for my mom, it was law in the house, right? And so think about what that means and the power and how you use your doctors as champions for this work. And so I'll leave folks with a couple of just nuggets to think about as you develop your civic engagement work. It's important to understand how elections work, which Eric went over extensively. It's important to understand that you can work with your registrar of voters in your local county to partner and figure out how you can be most helpful to make voting accessible if that's something that you want to do. It's important to onboard your organizational leadership in this work. We are blessed in AltaMed to have the support of our CEO and our CAO and kind of have that support trickle down into other executive leadership. And that's how we bring in other departments. So how do you do the work, right, of involving your executive leadership in this work? It's important to understand that everything that we've, at least, you know, the work that we've shared on the AltaMed front, and similar to CPCA, is all C3 compliant. These are all allowable activities, but there does usually tend to be some misunderstanding in what folks consider, you know, politics and things that you can't do with elections versus things that are C3 compliant. And so most of these things, if you're not telling someone what candidate to vote for, are allowable, right? And we went over the do's and don'ts. So it's really important that you share that with your executive leadership if that's a concern that they have. Socialize your plan to include internal champions, staff, and vehicles for engagement. We have some doctors at AltaMed, and I'm sure many of you have heard of Dr. Shapiro, who are huge champions for this work. And so what we do is they help us socialize this work and the plans and what we want to do amongst other physicians as well, right? So how are you using your champions? And then understand bandwidth, visibility, adoptability, and celebrate the small wins. Again, here we're not saying everyone, you know, go and do this AltaMed program, right? We've been doing it for 4 years. What we're saying is what are the bits and nuggets here that maybe you having, you know, two staff kind of working on this, or one staff or 0.5 staff working on this. What are the small things that you can do that you think are great ideas? And then once you do those, you know, share the data with your executive leadership and really celebrate those small wins so you can expand on your programs. Next slide. So some resources, these are the resources that we developed for the primary election. We will be developing very similar resources for the general. And so folks will be able to download all of these if you know, again, if you have kind of one staff, 0.5 staff working on this, and you think, I really don't want to reinvent the wheel, by all means, use your stuff. We'll send you the PDF file. You can add your logos. You can reprint, you can just post it. However you want to make use of these resources, these are available for everyone, and we'll gladly share them with you all. Next slide. And where you can find these actually available for download is on myvotemyhealth.org or mivotomisalud.org. You can even find hold messages that we actually uploaded for when our patients call our appointment line. We can give you those MP3 files if you want to use them as well. They're very generic. There's election information now. There's a countdown to the general election. So anything that is up there and says download, please by all means use. We will be uploading new resources for the general election as well. Next slide. And just very briefly, I wanted to close out with what, you know, I shared the model. So what were we able to achieve this past primary election using that model? For our voter outreach efforts, we actually targeted 200,000 new and low propensity Latino voters in LA County and Orange County. We were able to reach 218,978 voters. So that was about 109% of our goal. We hosted 17 voting locations in Orange County and LA County. 611 ballots were casted or dropped off in those sites. Our most successful sites were our PACE centers. For our in-clinic reach, we reached about 152 million impressions through our screensaver work, which I shared earlier. We actually, this time around, engaged the LA mayoral candidates, Representative Bass, Kevin De Leon, and then we invited the rest of the candidates as well. And we did some advice with Entravisión so that we had them answer specific questions around social determinants of health and their plans to address those. And then we got those videos and we circulated them throughout all of our clinics in Los Angeles. So that led to about 79 million impressions. And then we distribute 26,000 campaign materials amongst our clinics. For community reach, I mentioned that we did radio, we did streaming, and we did the LA Mayoral Town Hall. Combined, we had about 5 million impressions doing that work. Next slide. Here's more information. Follow us on social media. We just kind of started our own social media, which is kind of sub to AltaMed, but you'll see that AltaMed reposts everything that we post on My Vote My Health. We're on Twitter, IG, Facebook, and of course our website. You can also opt into our text. We have a texting platform, and you'll get updates from us as the campaign moves forward for the general election. Next slide. And that is it for me. Here's my contact information. We're happy to work with you all. This model is not just for LA and Orange County. This model works anywhere in the state. We're able to access voter data anywhere in the state. This is a program you all wanted to test out, if not for the general in 2024. And so let us know how we can help you establish these programs within your CHCs, or if you just have any general questions, there is my email. And with that, I will turn it over to my colleague, Mike at Asian Health Services, who has been a great partner of AltaMed in doing this work. Off to you, Mike.
Thank you, Lizette. And also shout out to Mara, who is running the slides, playing a lot of important work that y'all can't see. Thank you, Mara, for doing that. Hi, everyone. I'm Mike Locke. I go by he and him, planning manager at Asian Health Services. And I think I can just stop because Lizette, has covered such a great foundation of information. But I wanted to add a few things. And when Eric, Lizette, and I were having planning meetings to discuss this, we were understanding that all of our centers are very overworked and probably stressed given COVID and all the things that we're working on. Now monkeypox coming along the way. But knowing that different organizations might have different levels in this work. And speaking on Asian Health Services and AltaMed, who have more established programs, hopefully this won't be too intimidating for folks. But as Lizette had offered, and I'll offer on behalf of Asian Health Services, if there are ways that we can help, to get folks, to be able to do a little bit more than you've done in the past in terms of for the elections. Happy to do that. So before we start, actually, use this graphic that I showed for the title slide. But just a little bit about me. I've been at Asian Health Services for about 8 years. That's the short story. But actually, my involvement with AHS is close to 20 years ago. About 20 years ago, when I was in high school, I was a volunteer with AHS Youth Program. And during that time, we had gotten involved in a pedestrian safety campaign because there was a senior community member who was hit and killed actually in front of one of our clinics. And actually our CEO, Julia Liao, she had just joined the staff at the time. She led a pedestrian safety campaign in the area to look at trying to make the streets safer, and enlisted the help of some of the youth leaders, such as myself, to help do some of the research, time lights, measure crosswalks, and speak in front of the Oakland City Council. And I mentioned that example because, I'm sorry, you might be hearing my dog. But I'm mentioning that example because as Lizette mentioned, civic engagement is not just about voting by itself. Voting is definitely a really important part. Voter engagement, like voter registration, voter turnouts. But civic engagement represents all the things related to the social determinants of public health. And those are things that AHS has been doing for the almost 50 years we've been around. Next slide, please. So just again about us, we've been around since 1974. And as folks had mentioned, as Lizette had mentioned, just like CHCs have a big history connected, with the civil rights movement. I believe it was folks who, out of like the movement for ethnic studies, there were a lot of folks who came together and, created our first clinic in a one-room clinic with like 2 staff and a volunteer. And now we're up to having close to 500 staff. But we provide, medical care, dental care, mental health services. I mentioned our youth programs and a lot of great things just to serve the diverse needs of our community. I'm really proud that we serve folks in 14 different languages, a dozen of them being Asian languages, and really focus on trying to add layers of cultural competent care. Next slide, please. Yeah, just little bits about just the nature of some of our things at Asian Health Services, that we see just a wide range of patients and families, and just a variety of needs that they come with us for. Next slide, please. All right. And I'll talk about our community service programs. So in addition to, as I mentioned, medical, dental, and mental health care, we have a variety of different programs ranging from an HIV, comprehensive HIV program focused on, testing and treatments. The youth program, which will always have a special place in my heart, even though I'm no longer a youth. And part of that engagement and getting civic engagement part, a key part is that it's patient driven. So we have currently six patient leadership councils that are made up of current patients who, and these you see listed there, it's based on different, ethnic or language groups. But these are patients that, they go through leadership trainings with us. They learn how to become advocates, and they share with us key insights about how to improve patient care. So it goes both ways, and our PLCs are definitely front lines of the different things. And last, I'll just mention this is, we've worked with different partners on community safety in our area. You all may or may not hear, but just, with the increase in, hate and violence on Asian communities, there's been a lot that's been focused in and around Oakland, Chinatown, where most of our clinic sites are based. But we have worked on different programs as far as, trying to look at, policies and programs that can help make things better. And one program that we're particularly proud of is the Chinatown Ambassadors Program, which has been primarily run by folks who have been formerly incarcerated. And it's been a pathway to help them build skills that could help them towards breaking some of the cycles of incarceration, but also helping them, improve the vibrancy of Oakland Chinatown, as well as just keeping eyes on the streets. I'm proud of this program because, we've given opportunities to folks who might not have otherwise been able to get a job anywhere else. And it's really, as there are cities like the city of Oakland, funding is very much an issue. Our Chinatown Ambassador Program, does what it can to, improve the vibrancy of Oakland Chinatown, giving some difficult times. Next slide, please. Cool. And this slide, just wanted to share a little bit about this slide. But again, with the theme that civic engagement is not just about voting, it's about being advocates for our patients and communities whenever we can, and not just when it's convenient. But this is a picture from last year, as some high profile incidents that happened in our community related to violence, and that was creating a lot of tensions between Asian and Black communities. We came together with folks in the community to host sort of like a solidarity rally with folks in the community. We were in Oakland Chinatown. There's a park that AHS kind of takes stewardship of. It's called Madison Park. And in the center of that, our CEO, whom is also on the CPACA board, Julia Liao, is addressing the crowd. And there were community leaders talking about how we can't let some of these instances of hate and violence divide us and pit us against each other, which oftentimes happen. But we were trying to put together messages about unity, about healing, about how during these times we can come together. Next slide. So I'm gonna get a little bit into it, and Lizette gave a great overview of what it's like to do, this full range of voter engagement programming. I'll just say is I helped start some of AHS's field canvassing programs. It was based on getting funding for AHS as well as the California Healthy Nail Salon Collaborative, which is one of our fiscally sponsored programs, which AHS founded. And I started it 6 years ago, not having any previous experience running a campaign. I had door knocked before, I had phone banked before, but didn't know all the things that went into setting those things up. But learning how to access voter data, learning all the steps to organize a phone bank shift or a door knock shift, realizing it's really important, as Lizette had mentioned, to just be out there. And I'll say is for AHS, in addition to our great clinics, we being truly community-based, it's important for us to be out there, at the community centers, at the playgrounds, and really out there in the community. Not just that build it and they will come, but being proactive in there to reach out more folks. So this was a picture from, this is pre-COVID, this is 2019, but example sort of our phone bank program. And we've tried our best to have it be multi-generational and multilingual. And I'll say is some of the folks who are AHS patients, but they're also working with us with the California Healthy Nail Salon Collaborative. They were doing Vietnamese in-language phone banking to different Vietnamese communities in the Bay Area. And there are some other folks who were doing similar voter outreach to voters in Alameda County, as well as Santa Clara County, where we do different work as well. And, I can't say enough about how it's important to reach out in order to talk to the lower propensity voters, because in our communities, the hard to reach folks include the folks that are limited English speaking, and so on and so forth. Yes. So next slide, please. Just saying here is, this is a picture of Dr. Sue Chan, who is actually AHS's one of our first physicians, and she's still practicing today. So she's been practicing with AHS for our whole 46 years, but she has taken the time when she can out of her schedule to phone bank with us. And when talking to voters and talking to them about voting, and they say, they're not going to vote, she's spending time really challenging them and trying to convince them to vote. Oftentimes we hear from folks, and this happens a lot in BIPOC communities, feeling like their voices don't matter. But, this is why it's important we do. Sorry, next slide, please. Yeah. And then here's some examples just of us doing field canvassing and the importance of, next slide, please. All right, next slide. I'm just showing a lot of visuals here about some. But I want to just say is that we created a lot of in-language materials just to get words out to folks in our communities. This was from a patient newsletter that we had sent out to patients, reminding them about different things, including about voting. And oftentimes our patients read our new patient newsletters. We send it out to over 30,000 patients in 6 different languages. And folks call back, or when they came for appointments, would bring the patient newsletter with them, and we'd help them through stuff like that. Next slide. Yeah. I'm going to go through, sorry, I'm taking up too much time. Just keep on rolling through the slides, Mara. Yeah. Next slide. Stop right here. Stop. The next one. Last one I'll just say is that, we put together materials on trying to do some reminders to our patients about voting, because just because folks register to vote doesn't mean that they're always that they know about all the steps, especially with vote by mail and all those things. Last year, particularly with the recall, there was also a special election related to Assembly District 18. And we just needed to remind people that in that area that you're getting 2 ballots, and it wasn't a mistake, and don't try to fit both ballots in the same envelope and things like that. So just keep on rolling through the slides, Mara. I know, sorry, I took up a little too much time, but I just want to say is, really, the civic engagement piece has become a really important way to connect with folks, especially during COVID. And we are definitely happy to do our part. And if any of the CHCs on here who want to try to do some stuff during this coming election cycle, please let me know how I can help. Yeah, and back to Eric.
Great, thank you. Thank you so much, Mike and Lizette, for going over all of the amazing work that you do. Just real quick, I just want to go over some resources that California Health Plus Advocacy has made available for the general election. So next slide. So here on the screen, you can find our Civic Engagement Center. This is, the link here below that Raquel has just posted. When you click on it, this is what will come up. You can enter your address, and when you do that, next slide, please. You will see that there's information on candidates for your community, but also elected officials, right? If you're not able to vote, you can still see who represents you in your communities from all levels of government. Next slide. Great, and then social media toolkit. So we've put together a social media toolkit. On the left-hand side, you can see all the graphics for the general. And then on the right-hand side, you'll see the toolkit with sample social media posts. Please utilize them to remind people about important deadlines and about the election. Next slide. And then really quickly, California Health Plus Advocacy and CPCA has taken position on 2 important ballot initiatives. Next slide. So the first one is Proposition 1, the Right to Reproductive Freedom Amendment. This proposition here, if passed, would amend the California Constitution to establish a right to reproductive freedom. A yes vote would support amending the state constitution to prohibit the state from interfering with or denying an individual's reproductive freedom. So this came after the Supreme Court decision that overturned Roe v. Wade. So we are supporting this proposition. Next slide, please. So Prop 31, the flavored tobacco products ban referendum. So this is a referendum that was put on the ballot. So tobacco companies are trying to overturn a law that passed in 2020, also known as SB 793. This law, prohibited the sale of most flavored tobacco. So a yes vote would uphold this bill and ban the sale of low flavored tobacco. So we are supporting this proposition. Next slide. So that's it. That wraps up our training. We tried to get through this as fast as we could. Mara or anyone on the back end, have you seen any questions come in?
I just see the links, and I would recommend anybody who would like to ask any questions, go ahead and raise your hand. Feel free to unmute yourself, announce your name and ask the question, or make a statement. We welcome. And I do not see any questions in the Q&A. I believe you covered it all. Did a great job.
Great. Well, thank you everyone so much for joining. We will send out a follow-up email with resources. We'll also include Mike and Lisette's contact information in case you want to reach out to them. So yes, thank you to our wonderful facilitator. Thank you, Marisa, for the work on the back end, to our intern Raquel for also typing all that information in the chat. Thank you all so much, and we will talk soon. Thank you so much for joining our training.
Thanks, everyone. Bye-bye.
Thank you, Eric. Thank you, Lizette. Thank you, Mara.